Today, my group will talk about dengue. What is it? It is an acute viral disease that can affect people of any age, especially children and older adults. Caused by a virus transmitted through to the bite of infected mosquito Aedes aegypti. Dengue mosquitoes occur in urban areas with altitude below 2,200 meters above sea level. They lay their eggs in clean water reservoirs such as swimming pools, vase of aquatic plants, tires, bucket of water, and any container that is out in the open, and that it can store water. Dengue is characterized by fever, bone pain and headache, joint pain, loss of appetite, and pain behind the eyes. There are some symptoms that are alarming, such as major decay, persistence of fever, bleeding in the gums, in the urine, bruising of the skin, and persistent abdominal pain. Do not self-medicate. Go immediately to the doctor to receive the necessary care. Complications and the risk of death are preventable. If death early. Dengue is caused by any of four types. Dengue is caused by any of the four human dwellings. When a mosquito bites a person infected with the dengue virus, it enters in the insect. When the infected mosquito then bites another person, the virus enters that person's bloodstream. When you heal from dengue, you are immune to the type of virus that infected you, but not to the remaining three types of dengue virus. The risk of getting severe dengue, also known as dengue hemorrhagic fever, actually increases if you become infected a second, third, or fourth time.
The first reference of a case of dengue appears in a Chinese medical encyclopedia published in the Jin Dynasty, formally edited during the Tang Dynasty and published again during the Northern Dynasty, which describes a king of poisoned water associated with flying insects which caused very high fevers after their bite. Dengue spread outside Africa between the 15th and 18th centuries due to the development of the merchant marines and the increasing migration of people, especially in the 18th and 19th centuries, which caused the poor cities to grow and urbanize, creating conditions ideal for the habitat of the vector mosquito. During sea travel, the mosquito was kept alive in the water tanks of the winners. In this way, both the mosquito and the virus expanded to the new geographic areas, causing epidemics separated by the intervals given. Several descriptions of epidemics during the 17th century, but the oldest report of a possible dengue epidemic dates between the 1779 and 1778, when an epidemic hit Asia, Africa, and North America. The first definitive case report dates from 1779 and is attributed to Benjamin Rush, who coined the term Bonner-Break fever for the symptoms of myalgia and arthralgia. In the 76, the transmission by the Aedes mosquito was confirmed, and in 77, dengue was the second known disease which was caused by a virus.
Risk factors. Factors that increase your risk of having or a more serious for the disease include life or travel in tropical regions, being in tropical and subtropical regions increases that the risk of exposure to the virus that causes dengue. High risk are in particular Southeast Asia, the Western Pacific Islands, Latin America, and the Caribbean. A previous infection with a dengue virus increases the risk of serious symptoms if you reinfect. Dengue risk areas. Dengue outbreaks are occurring in many countries around the world, in the Americas, Africa, Asia, and the Pacific Islands. Anyone living in or traveling to an area at risk for dengue is at risk of contracting the infection. Before you travel, find out country-specific traveler information to help you plan and back. 40% of the world's population, around 3 billion people, live in areas at risk of dengue. Dengue is a leading cause of disease in many countries. Dengue emerged as a global problem in the 1960s. The disease is common in many popular tourist destinations in the Caribbean, including Puerto Rico, Southeast Asia, and the Pacific Islands. What do in case of having the disease? Do not self-medicate, drink plenty of fluids, go immediately to the health institution, when to see the doctor. If you have urgent symptoms such as severe and abdominal pain, vomiting or blood in your nose, dumps, vomit, or stool. If you have a fever and frequent milder dengue symptoms, contact your doctor.
Types. There are two types of dengue. Classic dengue, which does not usually present many complications, since the body tends to recover completely with proper care. Severe dengue, formerly known as hemorrhagic dengue, which is caused by serotypes then 1, then 2, then 3, and then 4, with an incubation period of between 5 and 8 days. It is a serious manifestation and can cause the death of the patient because it can appall tachycardia, pain in the bones, hemorrhagic alteration of blood pressure, circulatory insufficiency, or dehydration. Diagnosis. There are several tests that can be done confirm the diagnosis of this disease, such as a laboratory test to measure the level of antibodies throughout a blood sample, a complete blood count, or liver function test. Treatment. Expert says there is not a specific treatment for dengue. However, assistance from psychics and nurses who have experienced the effects occurs of the disease is essential to save lives and reduce mortality rates. In general terms, the treatment for the genes for is done with anti-inflammatories, antipyretics, and rest. In severe forms, electrolyte balance is restored, and if there is bleeding, a blood transfusion and platelet count may be required. Recommendations for the community prevention. To prevent dengue, water reservoirs that serve as breeding grounds for mosquitoes should be avoided in order to reduce their reproduction. For this is humus. Frequently change the water in animal drinkers and pens. Cover the container with water, eliminate accumulated garbage in patios and outdoor areas. Eliminate types of storage in closed places. Use repellents on areas of the body tied or covered. Wear appropriate clothing, blood sleeve, shirts, and long pants. Use mosquito nets or mosquito nets on beds, especially when there are sick patients, to prevent them from infecting new mosquitoes or in places where children sleep. Washing and brushing hands on poles. Collect the garbage and solids in vacant lots and lots. Keep the yards clean and participate in community days to collect waste with community and intersectoral activities. Thank you.